Okay, welcome everyone to today's webinar, Managing Risk in Outsourced Clinical Trials, Practical Approaches and Tools. My name is Marla Helly and I'll be your trainer. So with that, we'll go ahead and get started. We're going to describe the attributes of risk management framework for the use of an outsourced clinical trial. Also describing the areas where we can have risk management when partnering with a CRO or a clinical vendor, and then also identify potential risk areas for an outsourced trial or trials. So first we have to look at what is risk. And if we can take a moment for you to chat what you think a risk is. Let's just get some information regarding what you identify a risk as being. So Anna said uncertainties. Very good. So something that is uncertain in our project, hard to control the uncertainty, perhaps from the CRO. So now we're looking at if we're going to give work to another individual, group, or team. Now I could have a problem if I haven't communicated clearly with what I want them to do. A potential problem. So we're starting to see that we could have issues, problems, or uncertainty. And when we look at the definition of risk, we can go to both the project management body of knowledge as well as looking at ISO 31000. We can see that risk is defined as an effect of uncertainty on objectives. And those objectives can be to our protocol, it could be to our business or organization, that are influenced by internal and external factors, which create uncertainty in achieving those objectives. And the effect of this uncertainty or risk is to meeting those goals or objectives. Pinbach goes on to say that this uncertain event or condition, that if it occurs, has a positive or negative effect on one or more project objectives, such as the scope, the schedule, the cost, or quality. So now we could have either a positive or negative effect on our project. And we can look at some of the positive things that might happen in our project, but also this could lead to some issues. For example, what if our enrollment suddenly became much faster than what we had originally predicted? Could that be a risk? If you think that could be a risk, give me a green check mark. Or you can answer yes using your chat button. And I see here that you have responded, yes, it could. And you're right. It could be a risk. All of a sudden now our enrollment has gone much faster than we anticipated or projected. So what areas of risk might we have? Take a moment and share what risk we may have if our enrollment goes much faster than we predicted. Quality control, lack of resources, change in scope. So very good. Also not enough drugs. So now all of a sudden we have patients coming in much faster. We want to make sure those subjects are eligible. We want to make sure we have adequate drug supply at those sites. Also, this could change the scope of work in the sense that maybe we didn't budget for all of this to occur this particular quarter or for this time period. So now that also changes our cost in the sense that now we didn't budget for this, and likewise, we are going to need to have those resources available.